Sending mental health experts to some 911 calls in Louisville instead of police, that's an idea that gained momentum during the summer protests of 2020, and it has now become a 6-month success story. WHS 1119's Ford Sanders and photojournalist Ian Hardwick are live downtown right now outside Metro Safe, where those calls come in. And Ford, how do they work this program?
Yeah, Doug, like you said, those going through a crisis would call 911, of course, but then operators at dispatch centers just like the one behind me would then decide whether that case goes to a police officer or if it should actually be assigned to a triage worker. A call for help in Louisville. Since March of this year, there's been a new way of responding to these types of calls.
How can we do better? How can we be better?
Kelly Jones is the deputy director for Louisville Metro EMS. He says a diversion program was vital coming out of an era of protest in 2020.
No justice, no peace.
It was a very challenging thing to do, something that wasn't easy. I enjoyed the challenge.
It's called the Crisis Call Diversion Program, and it kicked off in Division 4. That's South Louisville on March 21st this year. In a 49-day period, 119 people were helped by what they call Crisis Triage Workers, saving police officers around 100 hours of response time.
Yeah, what we're finding is that the police officers love it, and they recognize that they're not trained to handle every single situation.
Emily Dyer, the executive director at the Americana Community Center in the heart of the South End, says programs like these also help avoid any escalation at scenes.
There's someone who's coming without a uniform. There's someone who's coming fresh and new into the response in the system.
Saying the help from these triage workers goes beyond first response, as they know the ins and outs of some of these cases.
It's a lot to ask LMPD to have that knowledge base on top of managing general safety concerns.
Jones says there's a variety of situations these triage workers can be utilized in, like mental health or behavioral needs. With $5 million committed to the program from 2021 to 2022, he says now it's time they continue to show their success to be able to keep expanding.
We want to be a 24-hour service. We want to be there 7 days a week.
So I'm very hopeful that we'll expand that pilot project throughout this city, and we'll see its effectiveness everywhere in our community.
Now working to make sure Louisville is leading the way in its response. And Jones tells me they actually have expanded as of today. We just saw that those triage workers are in Division 4, but they're now in Divisions 1 and 2 as well. One of the things that they talk about when it comes to expansion is just making sure they have enough people to fill those roles. Live in Louisville, Ford Sanders for the WHAS 1119 on your side.